with the passing of the National Cancer Act in the early 1970s, a requirement of that act was that each state set up a cancer registry. It's usually called not a state cancer registry, but a central cancer registry. And those central cancer registries are governed by a program called the National Program of Cancer Registries at the Centers for Disease Control in Atlanta, Georgia. So they are government funded, and what their goal is to collect information on every newly diagnosed cancer patient in their state every year. And so because of that, we have data that's available from every one of the 50 states that's aggregated every year by the National Program of Cancer Registries and then analyzed. So the national cancer health statistics that everyone reads every year about this cancer is rising or this cancer is decreasing come from the amalgamation of all of the state cancer registry data. Because brain tumors are so complex, remember we discussed the fact that there are over 100 different types of brain tumors. The National Program of Cancer Registries looks to the Central Brain Tumor Registry of the United States to analyze just the brain tumor data every year. And an annual report is published every year just focused on brain tumor specific statistics by the Central Brain Tumor Registry of the United States. There's also another component to the cancer registry system called the Surveillance, Epidemiology, and End Results Program, which is funded by the National Cancer Institute. And the difference with that program is that they are focused on certain states and certain metropolitan versus rural areas that allow them to be representative of about 26% of the United States. But the main thing that they do that's different is they do active follow-up. So they actually call every patient every year to find out what their status is. Wow. And that's different than the state registries, who clearly are not going to have the resources to call every patient every year. And so what they utilize are the national health statistics and the vital statistics that are kept nationally on all people who are still alive.